My name is Professor Karin Leder. I'm head of the Infectious Disease Epidemiology Unit within the School of Public Health and Preventive Medicine at Monash University. My research aims to better understand individual risk factors and risk exposures that are associated with acquiring infections in order to provide better evidence for prevention. There are two main contexts for my research. The first of these is infections associated with exposure to contaminated environments, and in particular fecally contaminated environments in urban slums of developing countries. And the second of the contexts is looking at risk factors for acquisition and spread of infections across international borders by travellers and immigrants. One of the most exciting projects that I'm involved with is called Revitalising Informal Settlements and Their Environments, or RISE, which is a Monash-led project that is international and interdisciplinary, and a really exciting project that is aiming to improve the lives of people who are living in urban slums in the countries that we're working in, which is Fiji and Indonesia. Everyone in some ways can relate to infections, and if not before 2020, at least in 2020, I think we've all heard so much about COVID that infections and understanding who gets infections, why, where and how to prevent them does touch all of us. On a really personal level, one of my sons was admitted to hospital with a severe gastro infection a couple of months ago, and as an infectious disease physician and epidemiologist, I of course start thinking, oh my gosh, where did he get the infection from? Did I serve him some bad chicken or something? But I think most people would be able to relate to the importance of understanding why certain people are at risk of getting infections and thinking through what the risk factors, the risk exposures may be, and ultimately with the aim of reducing the morbidity and mortality from infections. I'm fortunate to be working on a big project, Revitalising Informal Settlements and Their Environments, or RISE, which is a project that is going to introduce green technology, so green infrastructure, to improve water and sanitation management in urban slums or urban informal settlements. Our project is specifically working in Makassar, Indonesia, and in Suva in Fiji. And my role is to look at the impact of the infrastructure that we introduce, the engineering infrastructure that we introduce, and its impacts on the health of the environment and the health of the communities that are living in these urban informal settlements. The Faculty of Medicine, and in particular our Dean, Christina Mitchell, has been highly supportive of me and of other female researchers over many years. And so Monash is a terrific place for female researchers, and I think the mentoring programs that I've been lucky enough to be involved with are a perfect example of the kind of support that Monash offers.